good filling, Chris, thanks. So after this, we'll have a panel at the front, and then there'll be an opportunity to ask questions. So, over to you.
All right, good afternoon, everyone. We all still awake? Still with it? Good. In the after lunch slot. Right. So,
is there a clicker on there?
Is that? Yeah, we'll work this out. Here we go.
So hopefully your slide should be on there.
Oh no! No one should ever let me in charge of this sort of thing. Is it that one? Oh, okay, that one. Here we go. We're okay. Right. We're in business. Good. So, you might have just gathered I'm not here for the technical bit of today's presentation, from my fumbling around with just a simple mouse. What we do at Global Action Plan is all around engaging with people and helping people, whether they're at home, at school, at university, to move forward to be a little bit more sustainable than they currently are. Understanding where they are, where they're coming from, and what they can do to become more environmentally friendly. What Chris has asked me to talk about today is another complex working environment, following on from Alex's talk, which is about NHS work. We find that actually there's some similarities with universities. There's a big bunch of people who work for the organisation that run the buildings, but there's also a heck of a lot of people that you don't control in those buildings as well. So you have patients and staff in the hospitals, you have staff and students in the universities. So a couple of questions that I wanted to go through today. One is, how do you get people to really care about your energy programme? The people who can really make a difference to how much of a saving you make every year. And then we're going to come on to talk about how green skills can become part of this agenda as well. Very briefly, a bit of information about Global Action Plan. We've been around for 21 years. We're an independent charity. We're endorsed by the United Nations Environment Programme. Some of my clients are there. Right hand side there. Right hand side, left side. Oh, I'm facing the wrong way. And also some of the awards that we've won recently as well, actually mostly for the health work that we've been doing, which is all very nice. Onto the project, which is really where it gets interesting. So, this is a project that we've just started in the last month with British Gas down at Brighton and Sussex University Hospitals. It's an EPC. We kind of jumped the gun a little bit on the behaviour change piece because we needed to do a lot of research on that front while we're finalising the contractual stuff. This is the challenge. Royal Sussex County Hospital, part of the campus down in Brighton. That building, which is pretty old and kind of windows don't close and things. And then this building, which is just over the road, which has just won architectural awards for its boat theme, is the Children's Hospital. So, buildings that can, actually they've got the oldest hospital building in the country that's still working apparently there, built in 1830, the Barry Building down in Brighton. So almost 200 years worth of estate that's still commissioned. And then, you have thousands of these lovely people who all have dreams, desires, hopes, wishes, fears, worries, lives, interesting, busy lives going on. How do you combine the energy work you need to do in those buildings with these people and their daily jobs? So, there we go. So, I'm going to talk a little bit about some work we did back at Barts Health Trust over the last couple of years. And the first thing we did was go and talk to the nurses. We wanted to know what gets you motivated. Why do you come to work? And you can probably have a guess. Why do people say they come to work? If you put yourself in a nurse's shoes for a minute, what are the things they get joy from when they come to work? What makes them happy?
Helping people.
Helping people, yeah, great. Any other ideas?
Getting paid.
Getting paid? Yes. A little bit of money. Do they get paid?
Enough.
Yeah, not much. Anything else? What makes them happy when they're at work every day?
Being recognized.
Get recognised, yeah. Get to have a chat with people. They kind of like being friendly. They kind of like being. There's real camaraderie on the wards. So they get pleasure out of being part of a team as well. So they love seeing people get better. They like patients, visitors coming in and seeing them and having good interactions. So it's the whole human side of things was really what came out loud and clear when we did focus groups. We also asked them about kind of saving money. Is that a good thing, saving money for the trust? You know the trust is short of money. And also we asked about environmental impact. Is that something you care about? Basically, they said, yes, we care about all those things. We care about our patients getting better. We care about our staff team having a good working experience. We care about the environment, and we care about saving money. Kind of when push comes to shove, you can kind of draw a line across the middle here. And if they could do something differently to improve patient experience, they're really likely to do it. If they can do it, there's no barriers in the way. If there's something they could do differently to improve the people part of it, the staff team, and the experience of their colleagues, they would do it. Then when you go down to Planet and Pocket, like, well, we know we should be doing this, but those are the two things come first for us. So if you're just coming to me talking about polar bears, I've got other things to worry about, thanks. So, with that in mind, we knew that we needed to connect energy management to patient experience. So we kind of racked our brains for a bit and kind of worked out all the different ways that having a better energy managed building is better for your patients in the hospital. And there's lots of simple things. So, this is what's been going on in hospitals recently. On the far side, at Barts, we have been doing quiet time. Some of the wards were already doing quiet time. Some of them weren't. We asked the ones that were doing quiet time why they did quiet time. So patients can have a rest, so they can get on top of what's going on in the wards. They dim all the lights, they get all the patients in their separate rooms if they have separate rooms, close the doors so that air-conditioned systems can make the building get to the right temperature. But it was only happening in some of the wards, so we just kind of spread that around and got other people to do quiet time. So you're turning the lights off, good for the energy, you're better controlling the building through windows and through door closure, which is better, much better for the BMS control buildings. And over at Frimley Park, the nurses there decided that they should have a nighttime curfew. The only blot on their copybook at Frimley Park was the noise at night metric, and the patients were reporting there was a real problem for them. So the nurses decided to implement a nighttime curfew where you go into nighttime mode, and as well as doing things like making sure the lights are out wherever you can and get everyone sort of tucked up and cosy, also trying to make sure that the night shift, who are in the daytime in their heads because that's when they're awake and at work, are actually remembering that everyone else is on nighttime mode and they're walking around quietly and whispering and all the rest of it. So, linking in those energy actions to patient experience. And there's some things that staff needed to know. So they actually just moved into the Royal London building, which is a fantastic world-class new building over in East London. They have lots of these rooms which are pressure controlled rooms. So if you've got someone in there with something that you don't want to get out of that room, you can kind of lower the pressure inside, so when you open the door all the air rushes in. And if you've got someone inside that room that has got something that means they are really susceptible to germs, and you don't want anything to get in the room, you can turn the pressure the other way, and so when you open the door the air rushes out, and they don't get any of the germs that might be in the corridor. So that was new to lots of staff. So you needed to understand how to use the door, basically. And also there were three settings on light switches, which was new, and people didn't want to mess around with them, because you had on, off and dim, and that was new to staff. So there was a whole tutorial around how you use this building. And then some high energy areas, perhaps, where actually the staff are so expert, it's not as simple as me walking in and saying, maybe you could sort of turn that off, or maybe you could just close that door a bit and go around the space. They had these isolated units which no one actually knew who owned them. They were sort of running all the time. They were paying someone to maintain them. But in the 5 years that it had taken to commission the building, get it up and running, they were just kind of redundant. So we managed to kind of find people who really knew what they were talking about. And we could only do that if we talked to staff about this whole energy engagement project. And then they were able to find us ways to save energy. And then this is the result of the last 2 years' worth of work at Barts. I'm going to start off with all the patient things first, because that's what excites people in the hospital. So, patients reported a quarter fewer privacy intrusions, because we can get people to close doors, basically. They've reported a third fewer sleep disruptions. We've measured a few different times, sometimes it was 10%, sometimes it was And that's through things like quiet time, it's also things like at night, making sure that people aren't tucked away in their rooms. Patients have said that they have an overall better experience in the hospital when they get better sleep. And they've also been saying to us that they are less likely to ask us to change the temperature in the rooms because we're able to better control them. There's no system change in any of these buildings that we've been working on at that time. It was all just through staff changing their actions. Then the staff have been saying, we feel like we have a better relationship. We feel like we're proud to be working in these wards. We're thinking about how to give patients the best possible built environment. And also, it's actually got us working with other people. So the cleaners and the nurses on the ward have exactly the same things to do. And there could be sometimes a bit of a divide between the clinicians on the wards and the support staff. And this is giving something, it's a project that everyone can work on. So there are other benefits other than just the patients and the savings, 428,000 annual saving figure so far across the estate, which has a similar energy bill to Alex, about 13 million. And then we kind of did some carbon numbers as well, so far 1,900 tonnes of carbon annual saving. And there's this thing in the middle, which we kind of worked out if every hospital in the country did this, we'd save about £35 million a year. At the same time as improving patient experience. So I think that's a really exciting thing that we are kind of exploring at the moment. Very briefly, some engagement techniques. This was the very first thing that we did to start off the campaign. We did a thank you campaign. Our very first thing was to say thank you to everyone. So we found enough people in the hospital who were doing these actions already. We didn't go in there and say, hey you lot, you're not doing this stuff, please do it, it's a really good idea. We said, who's the person in here who always turns the lights off, always closes the doors? We found that person, we took a photo of them. Once they'd let us take a photo of them, their team got a reward just before Christmas 2012 of a tin of biscuits, just for the staff on that board. They like team rewards rather than individual rewards. That's another thing we found out. So look, what we did with those pictures was then this social norming exercise down here. So we had some flyers which showed nursing staff from your floor of a 16-storey building, your people doing the actions. There's more than one of them on the flyer, there's 4 of them on the flyer. It's like there's lots of people doing this thing already. It is the norm, I'm expected to do this. If they can do it, why can't I? There's a whole load of psychology, sociology stuff going on in this short exercise of just showing that people are doing the desired actions. Pens with Operation TLC, I think pens we found for nurses was one of the most kind of precious resources, that they've always putting out pens, and so there's always one in the pocket. So we got a load of pens out there as a reminder to do the action. And then on the far side, that's Steve Ryan, the medical director of Parts. Staff did need some help to feel like they had permission to change their local working environment. So we did some screensavers with the medical director saying, if you guys know your health and safety, you know what's good for patients, if you want to change the ward and have a longer quiet time, and you know that, do it. You have permission to use the space how you see fit. And as I said, there's a massive opportunity here, which we're kind of trying to work out how to do at the minute, which we could save a heck of a lot of energy and carbon across the whole of the country if we got hospitals to do this. We don't need to answer this question now. That's one for another time. Now, what this got us thinking about, moving on from within the hospitals now, moving to outside the hospitals, we started thinking, well, if you can make that connection between something that's good for the environment and something that's good for health, are there other spheres that we could work in? And there's a couple. Alex mentioned one, which is around warmer homes, which don't waste as much energy. And problems cost the NHS, I think, £50 million a year at the moment. But also, and I guess I say this standing in British Gas's head office, I think doctors and nurses are slightly more trusted than British Gas people. I have to say that. I don't know if you've ever done a study to compare the two, but I would say you would find that result. Yeah, I hope I'm not saying anything too wrong there. So, what we did was we did a project with British Gas at Barts, where we got the doctors and the nurses to be the ones that got the message out there, that there are free boilers you can get from British Gas. It's not a trick, it's not a catch, they're not going to try and sign you up for a 10-year contract or try and sell you wonderful things to go on your home. There's a number to call. Barts gave the kind of credibility and also the direct message to the people who are in most need. Because it's the patients that have conditions which will be exacerbated by being in cold homes that are in Barts hospitals, so they were finding the right people that need the help the most. Okay, so that was a pilot we ran last winter. And then this brings me on to the green skills piece. So we then thought, well, maybe we could get young people to be involved in this exercise, because we've heard there's green jobs, lots of them out there, what are they, and how do you actually get into them? We ran a program called Transform with British Gas, which takes young, previously unemployed people and provides a very short training course with some guaranteed jobs at the end of it. Those jobs are being British Gas community officers, and when they need to find premises that they can do energy efficient works in, or they need to go to a housing association and speak with every member of every resident in the place. You need a lot of boots on the ground, so getting these guys trained up and into jobs. So what we did was connect a training course with Job Centre Plus, Global Action Plan on the training course, and there were a certain number of guaranteed jobs with British Gas at the end of it. There were 23 jobs available in the first 3 pilots we ran at Newcastle, Solihull and Glasgow, and we found and were able to train more than enough people. Actually, you would have taken more if there were more jobs available. Sadly, that was as many as we could do from the number of people that we trained. Which brings me on to universities, finally. It's on my last slide. Got there in the end. In our work with universities, we're finding that the green skills agenda is beginning to come in. So there are 2 projects that we've been working on over the last 6 months with London South Bank and Cambridge. And going back to that point that I started off with, right, what actually motivates people to care about your energy program or to be involved in your sustainability program? We're asking the same questions at universities that we asked to nurses. At London South Bank University, one of the things that one of the lovely phrase that one of the students came up with was that kind of green skills can help you to pay the bills. And the idea that, I think the number was, I'm going to check my notes for this. Oh, yes. So 70% of students said that they thought that green skills was going to be important to them in their employment in the future. So that's a huge percentage of people who have an interest in the work that you're doing across your estates. It's a great starting point to go and talk to people. And then also we went to, we've been working in Cambridge recently, and we often do a survey that is taken from a DEFRA study about 2006, 2007, which looks at people's motivations to do environmentally friendly actions. It's called the DEFRA segmentation study. There's one group in that study called Positive Greens, and they are people who are, I guess, a bit like me, they will do things just because it's good for the planet. So if you ask me to kind of recycle something or not eat so much meat or maybe get on the train rather than flying, because it's good for the planet, then I'm quite likely to do it. And I'm weird for that. There's not many people who do that. It doesn't make me better or anything else, it's just weird. So it's about 18% of the population when DEFRA did the study. When we did the research at Cambridge, it was their figure was less. It was 13%. So only 13% of the population of staff that we surveyed at Cambridge would do the environmentally friendly thing for the sake of the planet. So if we're going out there running campaigns, sustainability campaigns, energy saving campaigns, and we're just talking about do this because it's better for climate change or to save the polar bears or however we're framing it, we've got at least 85% of the population that really don't care. We've really missed what motivates them. But there are things that motivate them to get interested in your agenda. The green skills piece particularly. We think that I basically have 3 things that I want to leave you with as useful behaviour change knowledge to have when you're thinking about running an engagement programme at your hospitals. They are, the first one is information is necessary but not sufficient. Okay. So when I showed you kind of nurses needing to actually know what to do with the light switches, they needed to know that information, but actually it's still not enough to make them do it. So just remember, information is necessary but not sufficient. You can tell people what they should do and how to do it, but unless they're motivated to do it, they're not going to do it. So information is necessary but not sufficient. The world is not enough. My second one I'll leave you with. 13% of positive greens. If all you're talking about is the planet, you're missing 87% of that population. What's the third one I wanted to say? Oh yeah. So that leads me on to accentuating the positive. Turning lights off in hospitals had all those benefits that we'd never thought of before. And it was only when we started talking to the staff and worked out actually what they cared about that we had to go through the hard thinking of working out what turning the light off actually does in a hospital. There are so many positives to all the work that you're doing, from perhaps creating a better temperature controlled environment for your students to sleep so that they get helps them towards their ultimate goal of getting the grades they want. There might be all sorts of these little bits where you can kind of say, we are going to help you get to where you want to be, and that's to become employable, to get the best grades, have some fun. There might be a competition element in some of the things that you do. Think of the reasons why people go to university. They're not going to university to save you money, and they're probably not going to university to save the planet. That will be a small percentage of them. But those planet savings can help you as well. That's a different topic for another time. So, find out what they like and accentuate those positives. I have left you some cards on your tables for you to have a little think, to maybe inspire some other thoughts. This is kind of our behaviour change, theory of change. So grab a card from the pack and have a look at that. But I think we're going to do some panel discussion now.
We are, yes. So, Chris, first of all, thank you very much.